Hi, good morning. I'm Chai. Welcome to our show, Heart to Heart with our doctors, FB Live, presented by Sunway Medical Center, Sunway City. All right, a few months ago, we have done a topic on bone tumor. And today, based on the feedback, actually, we received a flurry of positive reaction and comments with high number of engagement. I heard it was a little bit over 1 million views. So it clearly shows that this kind of topic actually can resonate wellly with our audience. Therefore, today we do it again, and it is our pleasure and our honor to be able to help so many patients from all around the world. During the show, actually, Dr. Chai has mentioned that we should do a topic on soft tissue tumors, and here we are today. We want to talk. And today, I hope that we not only have the local viewers from Malaysia, but hopefully we will have a lot of viewers from international as well. From what I heard last time, we have quite a number of patients and even Dr. Chai fans that has been on our Facebook Live last time. Let's see this time how many of them are actually from abroad. And if you don't mind, can you please type in the comments area, where are you coming from? Are you coming from Malaysia or are you coming from any other country? Let's see. And hopefully, and also ladies and gentlemen, to all the viewers, please say hi and also please type in where you're coming from. Maybe you are from Malaysia, from Philippines. I heard there's a lot of followers of Dr. Chai Ping-Ching is from Philippines. Let's see. All right, good morning. Okay, maybe you need some time to reach out to the audience. So, all right, ladies and gentlemen, and to all our viewers, good morning. And as promised, this time our topic is on soft tissue tumors, what you should know and what you should do. We still have the same doctor like last time, Dr. Chai Ping-Ching. And please allow me to briefly introduce Dr. Chai. I'm sure a lot of you know her very well. Dr. Chai Ping-Ching is an orthopedic consultant and oncology surgeon at Sunway Medical Center, Sunway City. She has over 30 years of clinical experience. She was the first Chinese female president of Malaysia Orthopaedic Association, and she was also the first female president of ASEAN Orthopaedic Association. Dr. Chai is recognized as one of the small number of surgeons globally. It is estimated that there were only about 500 bone tumor surgeons in the world, and in Malaysia itself, we have about 10 of them. And guess what? Out of 10, only 2 to 3 full-time bone tumor surgeons. And today, we're so lucky we have one of them on our show, which is Dr. Chai Ping-Ching. So guys, please make sure you stay with us until the end of the show, because if you do, you will be rewarded. Towards the end of the show, we have a quiz segment in which you can win 150 ringgit touch and go credit. All right, touch and go e-wallet credit. So 3 simple, super easy multiple choice questions will be asked, and as long as you pay attention to our show, you will be able to answer the question. So let's see who are on our live. So we have we have quite a number of from Malaysia. All right, Jessie, good morning. Good morning. And also, all right, maybe we haven't reached out to an international audience yet. So for now, ladies and gentlemen, to all the viewers, please help us to share this Facebook Live, because in our last FB Live, actually, we have reached out quite a number of patients from globally, which we help a lot of people. So you never know, with just a simple click, a simple share that you do, you might help someone to understand more about soft tissue tumor. You might help someone, and remember, helping is no border. There's no border, no country border to help people. So please help us to share these Facebook Lives. You never know, maybe there's someone out there in need in learning and knowing more about soft tissue tumors. And of course, throughout the show, you can ask a lot of questions. We have our doctor, Dr. Chai Ping-Ching, to answer all the questions. Okay, guys, without further ado, please welcome our guest doctor today, Dr. Chai Ping-Ching, an orthopedic consultant and oncology surgeon from Sunway Medical Center, Sunway City. 掌声有请我们的蔡冰清医生啊，骨科肿瘤外科专科顾问。All right, Dr. Chai, can you please say hi to our audience?
Hi, good morning from Malaysia. I'm Dr. Chai from Sunway Medical Center. Welcome very much.
All right. To all the viewers out there, can you please say hi back to Dr. Chai? You can type hi in the comments area, or alternatively, you can also send some emojis, like loves emojis or flowers to Dr. Chai. Okay, Dr. Chai, I think we only have 1 hour of live today.
Yes.
So we will go straight to the question. And
Sure.
again, before I forget, so to all the viewers, please make sure you share this Facebook Live, because by just a simple share, you might help people who are in need to know more about our topic today, which is soft tissue tumors. All right, so what is soft tissue tumor? Because I think some of them might have not heard about it before.
Okay. First of all, what is a tumor? So a tumor is a growth. Yeah, a growth which is abnormal growth.
Abnormal, that's a keyword. All right.
Yes. Okay. And soft tissue tumors are tumors that grow from soft tissue. So soft tissue can be very different, type of soft tissue. It can, there's anything that is not bone, anything that is not cartilage, not the teeth, not the nail. Basically, in the human body, belongs to a big group of tissue called soft tissue. So soft tissue can arise from fat cells.
Fat also considered soft tissue?
Yes.
Okay.
It can arise from muscles. They can arise from tendon, ligaments. They can arise from synovial linings. They can arise from nerves. They can arise from blood vessels. So it is a very broad group and very diverse and broad group of tumors that arise from what we so-called soft tissue.
So it's covered quite a wide range, quite a wide spectrum.
Yes, it is.
Literally just now Dr. Chai has mentioned.
It is more complex and wider and broader than bone and joints tumors.
So that means that besides teeth, nails, bone,
joints, cartilage,
cartilage, everything else is considered soft tissue, and which it can happen, it can develop soft tissue tumors.
Yes.
That is totally wide range. So which part of the body, what areas of the body, typically, usually will find soft tissue tumor?
Soft tissue tumor can grow in any part of the body.
Any
part of the body. But there is a
common one.
Very common locations. For example, the limbs. The lower limbs, the upper limbs, followed by the trunk. Okay, and also in the pelvis or inside the abdominal cavity, and we call it the retroperitoneal space. So it can grow in many places, but commonly in the limbs.
Commonly in the limbs.
Yeah.
All right. That understandable, because to me, soft tissue tumor, because it covers so wide range of spectrum, and it's very hard to identify whether it is a tumor or not. For example, I used to have a cyst on my back.
Right.
So how do we differentiate it? It is just a normal swelling, or it is actually a lump or a tumor?
Oh well, every swellings are abnormal.
Abnormal.
Yes.
Can you please describe more?
They are not supposed to be there, so they are abnormal. But to differentiate whether this is a benign lesion and a malignant lesion, sometimes it's not that easy as you think. It's not as straightforward as you think. Some of the cysts that you think is a cyst may not be a cyst, but it could be a tumor with a cystic component.
It could be what? Sorry,
Okay.
It could be a cyst with what?
Not every tumor is completely solid. Some tumor can be solid, some tumor can be cystic, some tumor can have a mix of solid and cystic component. So it takes the person who examine the patient a lot of experience and knowledge to judge a lesion and to know that whether this is most likely a benign or a malignant lesion. Because they have their own kind of characteristics and features that the doctors will know.
Which means that it takes years of experience for doctor to identify.
Yes.
So, guys, to all the viewers
So
out there,
there are also some tumors that have very benign looking, but actually they are very notorious in the end. It's like when you look at people, some people may look like very good people, but they are actually bad people.
True.
It's the same.
Very good illustration.
It's the same thing for tumor. Some of the tumor looks okay. They are not scary looking. They They are not very big. They are not even fast growing sometimes.
I understand.
But they are there and they are bad. They will come to a time that they manifest themselves and they start to grow and cause all the troubles.
I understand. So to all the viewers out there, please don't be your own doctor. If you discover anything unusual, whether it's a lump or swelling, or even you think it's a cyst, please make sure you seek for medical attention. Look for the expert. Let the expert handle the matter for you. Please don't be your own doctor. I think that's the most important message that we would like to convey to all the viewers out there. And also to better visualize what is a soft tissue tumor. Actually, we have prepared a few photos to show our viewers. Then, of course, we need Dr. Chai help to tell us what type of tumors are there. All right, director, please show the photo. Okay, the left one.
Yeah, that swelling that looks like a little mountain on the shoulder of the man. Yeah, he has it for about a year. So it's getting bigger and bigger and causing him pain because it's sitting on his shoulder joint.
I see.
And that brought him to seek help. Yeah.
It has been a year. Did he come to see you when it is already a year?
Yeah, it's a year.
Okay, that's all right. The second one?
Second one is a tumor that has actually recurred. If you take a good look, there is a surgical scar in the tumor itself. And this gentleman has had a tumor excised from the abdominal wall before he came, and then the tumor grew back. Yeah, a tumor grew back, and that was very big and deep, involving the abdominal wall.
So this is abdominal wall. The tumor actually happened occur in the
in the abdominal wall.
Okay, understand. The third one.
Third one is a big and deep swelling. You can see in between the shoulder blades. So this one spread like a wing, like an airplane, inside the back, in between the shoulder blades, extending from the nape of the neck until the upper thoracic area. So this is liposarcoma, which is fatty cancer.
All right, we have two more photos to show.
Yes.
The left one is on the left side.
The left one, you can see there is also a surgical scar above swelling in the left lumbar region at the back. And this was excised a couple of years ago by another surgeon who did not suspect that the tumor was actually cancerous. And the excision was incomplete and the tumor grew back.
So on his first surgery, it just didn't suspect it was a cancerous tumor?
No.
Oh. So that means that there wasn't a thorough examination done on him. Can I say that?
No, that initial surgery was done by a general surgeon who did not suspect that this could be a cancerous one.
I understand. So it's very important to look for the right doctor to begin with. All right, I understand. What about the right one?
Right one is a little boy who presents with a fast-growing swelling in the elbow.
How long, based on the photo, how long has this
just a few months. Just a few months.
Few months already this big?
Yeah.
Wow.
It is big because this is a child. So this is almost 1/3 of the circumference of the distal arm, which is
Understand.
very close to all the nerves and the vessels in around the elbow.
Understand. All right, thank you, Dr. Chai. So, Dr. Chai, based on the photo that we have seen earlier, right? So it looks like soft tissue tumor can occur on men, on women, and also can occur teenager, can also happen on elderly. So my question is this: are there any demographic to show that certain group of people, for example, age group or gender, will be prone to have soft tissue tumor?
This soft tissue tumor can occur in any age group, from the newborn.
Oh.
Yeah, in my working experience, the youngest patient I had was a newborn.
That means just born.
I got the referral from labor room. The baby just born, and there was a tumor in the arm. So the tumor developed in the mother's uterus, grew with the baby, and when the baby was born, the tumor was already there in the arm, and it was cancerous. Okay, so it's a very, very wide spectrum of involvement, from children to adolescents to young adults to middle age until elderly. And for every age group, there are tumors that are more common for that age group.
I see.
You know, and as you grow older, some things will slowly like phase out, and some other new tumors become more common. So you know,
literally,
you see different type of tumor in different age group, but of course there are also tumors that can occur in throughout your life. Yeah,
I understand. So in that case, what are the most common soft tissue tumor for young adults?
Let's put it this way. What are the most common soft tissue tumors? Actually, the most common soft tissue tumors are benign soft tissue tumors.
Oh,
so
benign, which is not cancerous.
Yes, okay. they are more common, and the commonest soft tissue tumors of all is actually a lipoma. A lipoma is 脂肪瘤. Yeah, so it's a soft tissue tumor derived from fat cells. Okay, it's very common.
Very common, but it is benign.
It's benign.
Which is not cancerous. But however, are all benign soft tissue tumor are not cancerous? Can they become cancerous at some point in time? Or become life-threatening?
Most benign soft tissue tumors stays benign.
Most. But not all.
There are some exceptional kind of examples. For example, a neurofibroma, okay, which is a tumor involving the nerve tissues. Okay, and in a certain group of patients with neurofibromas, sometimes that benign neurofibroma can turn malignant into a malignant nerve cells tumor.
I see.
Yes. So there are certain but quite rare situations, benign tumor can turn malignant. But most of the benign, they stay benign. But not all benign tumor can be neglected. Some of the benign tumors have very bad behavior.
For example?
For example, like fibromatosis, which is very, very locally aggressive and infiltrative. But it is benign.
Oh. When you say infiltrative, means it can attack the
surrounding tissues like muscles, fascia planes and blood vessels, and the tumor grows like the roots of the tree. So it's just any space they just grow and infiltrate, and it is very difficult to excise because their recurrence rate is very high because of the behavior of the tumor. So different tumors have different behavior and characteristics. Not all tumors behave the same, and therefore it is very important to know what tumor is this, because it is just like human actually. A different human got different behavior and different personality. So are tumors. And in order to be able to have an effective management, treatment, excision, adequate excision, it is very important and very vital to know what tumor is this. It's like you want to go and fight with the neighbor or an enemy. You must know how good or how bad your enemy is, and you need to prepare yourself. Otherwise, if you're not prepared, you're preparing to lose, when you go and fight with people. So I always tell my patient, I said, you must know who is your enemy so that you and me can prepare adequately. And when we go in and do something, whatever we do will solve the problem once and for all. Because if you do not solve the problem the first time, and you had a recurrent tumor, for example, then the matter becomes more complicated, and you face a bigger surgery. With more complications, losing more tissues, more difficult healings, and sometimes poorer prognosis.
I understand. So in other words,
so you must always know what tumor are you dealing with.
And then you must always know that it's important you seek for the medical attention, the right medical attention at the right place at the beginning, because as mentioned, Dr. Chai mentioned earlier, if you fail to do it, treat it right in the first time, it's making more and more difficult for the second time.
The second time is difficult. The third time will be terrible.
I understand.
Sometimes it will come to a stage that the part of the body, for example, a limb, may not become salvageable. Even for some sort of benign lesions.
I understand.
So don't think that it is benign and therefore, okay, I can take it lightly.
I can wait and see.
No.
I understand. So as a lay person like us, right, it's very difficult for us to differentiate what is a benign soft tissue tumor, what is a malignant soft tissue tumor. So how to differentiate that? Or maybe it's really our job to differentiate them. A lot of people like to be their own doctor. So I really don't encourage all our smart people out there, please don't be your own doctor. But just for us, our knowledge, how can we differentiate it? Or is there a way for us to differentiate them?
In general, the bad guys will grow faster. Okay.
How fast?
So a malignant tumor, which means it's a cancerous growth, usually has a more rapid growing pattern.
More aggressive?
Yes, that means it grows faster. Okay. But growing faster doesn't mean it causes you pain. Most of these tumors, they are pretty painless until they start to invade into some nerves, some bones, some vessels and all this, and cause a problem. Otherwise, they are mostly painless. But in general, a malignant tumor has a faster growth rate. But there are also some malignant tumor that stays very quiet. The swelling is there for months, for even years. And then it's just patients say, he has been there for a long time, doctor. It's painless, it's not disturbing me. I can go on with my daily activities. You see, I can even go hiking, I can go scuba diving. It doesn't matter. Then one day, you notice that the tumors start to grow. And when it starts to grow,
exponentially,
very rapidly. And then the patient becomes scared.
Which sometimes can be too late.
Yeah. And then they will come and see the doctor. Usually, this is very common for my practice.
I understand.
Yes.
So this is what I very worried, because a lot of people have this attitude, right? I think it's painless. Since, like Dr. Chai has mentioned, most, not all, most of the malignant soft tissue tumor are painless. You can feel it, and you can do your daily activities. Tak apa.
And for Malaysians, we love to go for massage. This and that. A lot of traditional treatment and things like that.
And then, right.
Yeah, so that sometimes delay the patient from seeking proper help.
I understand. So the delay part is quite scary because, as Dr. Chai mentioned, when it start attacking you, it becomes very aggressive and can grow very rapidly, where it become problematic to us. So we have some question here. So yes, to our viewers out there, today is a golden opportunity. You know, have a free consultation from Dr. Chai Ping Ching. So please don't miss out this opportunity, because I saw in the group there's a doctor from LA Union. All the way from LA Union joining us. So if you have any question, so please type your questions in the comments area. There's one question here I just received. What kind of biopsy needs to be performed? What are its risk and accuracy?
Okay. Biopsy is a seemingly simple but actually very difficult procedure to perform. Now, before you proceed and do a biopsy, you must know which part of the tumor will be the most representative for the surgeon to take the tissue, so that the tissue will represent the real pathology of the tumor. Okay, all right.
Okay.
Tumor is usually not a homogeneous thing, so it is not like every part of the tumor is different. Especially in malignant tumor, it is usually very heterogeneous.
Which means that it looks very different.
Yeah, so different part of the tumor may have different composition of tumor cells, although the whole thing is a tumor, you know. And there are some parts that can have some degenerative changes, some tissue necrosis, which is very classic of a rapidly growing tumor. So the first thing is that you need to have a good imaging. A good imaging is vital. A good and clear, adequate imaging, and the surgeon must fully understand the involvement of the tumor, the characteristics of the tumor, and decide for himself how to approach the biopsy. Which part of the tumor is the best part of the tumor to be biopsy, so that when you take the tissue, it is the most representative. Okay? So a good imaging is very, very important, and the surgeon must go through the image very well and truly understand the tumor in the 3D context. MRI is a 2D image, but the surgeon must formulate that image in his or her brain so that this thing is a 3D thing, and must fully understand the anatomy of the affected part of the body and know that how to approach, how to go in and get the best tissue and cause the least contamination. So a wrongly done biopsy can have very bad consequences, is that it may cause contamination of vital structures, for example, blood vessels and nerves or other muscle compartments, rendering the part of the contaminated muscle not salvageable in the end of the surgery. So biopsy is a very important step. So it must be done by the surgeon who will do the final definitive surgery, because the planning starts from before biopsy until the very end. So it must be done by the very experienced surgeon. So our problem is that sometimes some doctors see a tumor and the hands are very itchy and say, okay, never mind, I'll biopsy, and then I will refer out after that. This is a very wrong approach. So biopsy must be done by the surgeon who do the definitive surgery. It is part of a big planning. Okay, if you do the biopsy wrongly, the whole thing will be, haywire.
Right.
And the biopsy tissue must be adequate. Okay, sometimes if you just do a very small biopsy, the tissue that you biopsy may not be adequate for a proper histopathological examination. Histopathological examination is a very complex process, especially for soft tissue tumor, and more so for soft tissue sarcoma. Patients never understand the complexities of a histopathological examination. And to make things worse, this thing is not very common, and therefore there are not many histopathologists who are well trained in examining a soft tissue sarcoma. Okay, it is a very difficult and very challenging kind of task. So if your histopathological examination goes wrong or not adequately done, and the pathologist derive at the wrong diagnosis, the subsequent treatment will be wrong.
Wow.
Because we surgeons, we base completely on the report of the biopsy.
Understand, which is
to make our decisions. Okay, so a very experienced pathologist is also very, very important. There are so many cases that the diagnosis was wrong in the first place. But when the patient come to us and we have a review of the histopath by a properly trained and experienced pathologist, then we get a different diagnosis.
Wow.
So it's sometimes a little bit scary.
Yes, it is.
Yes, so the surgeon must be experienced. The pathologist also must be very experienced. Otherwise, everything goes wrong, and the patient may even pay with their life.
Understand. So I think it's very important that we always go for the second opinion when we're diagnosed with a tumor. Is that right?
I won't say you must go to the second opinion. The best thing is you go to the most experienced, the best person the first time.
Get the right person the first time
Yes.
to do the job, so you will get a better diagnosis, and then after that you will lead to a better treatment.
Yes, tumor surgery is a very niche kind of subspecialty.
Understand.
And most surgeons in their lifetime do not see many of these cases.
Oh.
Very few. I mean,
yes, of course. Just now at the beginning I also mentioned that there's only 500 bone tumor surgery in the world.
Yes, but for a normal surgeon, a general surgeon, a general orthopedic surgeons, they don't see that many. Some of them can't even pronounce the name of the tumor.
Yes, correct.
If the doctor can't even pronounce the name of the tumor, he knows nothing about the tumor, then he should not treat the patient.
Understand. Not only
and soft tissue tumor, there is such a big, diverse group of tumor pathologies. With everybody has their own characteristics and behavior. So only the person that handle this type of problem every day, day in, day out, will be the safest. I will use the word safest.
Yeah. I understand. So I think for a better visualization for our viewers, right? Actually, we have a photo, a sample of the biopsy that a pathology will look into to decide what kind of tumor is that. Director, please roll the photo. So not this one, the pathologist photo, the samples. All right. So this is the reason I want to show this, Dr. Chai, is to let our viewers know that, all right, actually these are the samples that a pathologist will look into under microscope.
Before the biopsy tissue can become something like this that you see, it has to go through a very complex preparation. Okay, they have to gross the specimen, and then they have to fix it in usually in a wax block, and then they have to thinly size it with a microtome which is a machine that enabled the tissue to be sliced into micrometers thin. And then they need to do a lot of staining method with all kinds of chemical stains. And only the pathologists will know when they first saw the cells under the microscopes that subsequently what type of staining methods are required, so that in the end of the day they can zoom into the exact diagnosis. This is a very complex and difficult process, and only the very experienced know what to do, how to do. And when they see the cells under the microscope, they know exactly what they are seeing. Some people can see, but they don't know what they are seeing.
I understand. So it actually, in other words,
so the diagnosis can be wrong. And once the diagnosis is wrong, the treatment will be wrong.
I understand.
And the outcome will be entirely different.
So it's very important we have a very experienced, very expert pathology to diagnose.
It is vital.
I understand. It's vital.
It is vital. A surgeon cannot, a tumor surgeon cannot work with an inexperienced pathologist.
So you know what, a pathologist actually lay the groundwork for a successful treatment.
We work hand in hand. Tumor surgery is never a one man or one woman work. We work hand in hand with our colleagues, starting from the radiologists.
I understand.
The radiologists also play a very vital role.
Which is the first step in doing the imaging,
yes,
right?
yes. When you need to assess the tumor and things like that, you need to have good machine. You also need to have a good radiologist who read all the images and come up with a report before you proceed to do a biopsy and all this. And the biopsy will go to the pathologist. The pathologist will need to process the slides and then read all the slides and come up with the diagnosis that we call the histopathological examination report. And then we receive that. We need to sit down and discuss with the patient. Look, based on the MRI, this is how the tumor presents. It is involving what structures in your body, and this is the diagnosis. Now, what should we do?
All right.
Yes.
Of course, the surgeon, the pathologist play a very vital role for a successful treatment, and the patient himself or herself play a very vital role as well, because please don't wait and see, even though it's painless, please don't see the wrong doctor to begin with, because a tumor, a soft tissue tumor, can grow so big even though if it is benign. For example, we have a photo shoot to show you. This patient actually have a massive tumor that weighed 3.2 kilogram. Let's see a photo of him before and after, before the surgery and after the surgery. All right, on the left, on his right thigh, there's a big tumor that weighed 3.2 kilogram. It's almost as heavy as a newborn.
Yes.
So he has been carrying a baby every day in his right thigh. And then the right photo is after the surgery, so it's become flat. So now this is a patient that has sought for Dr. Chai's help. Now let us see one of his testimony video. Let's roll, director. Roll the testimony.
I just found out that why my right thigh was so big, suddenly swelled, or it's twice the size of my left thigh. Yeah, so he recommended. He said, "Vincent, go and see this Dr. Chai. She's one of the best." After the surgery, a doctor came to my room and told me, "Vincent, the tumor is 3.2 kilo. It's that big, but of course, removing 3.2 kilo from your thigh makes you feel lighter to move." Well, after the 3.2 kilo was removed.
Yeah. So he said, yes, correct. Actually, I loved watching his testimony video.
Yes.
No, it's such a comedy, and then he's so optimistic person. It's a very lovable person.
Yeah.
So, what is his story? He's Vincent Young, one of your patients, and I'm sure that 3.2 kilogram tumor didn't grow overnight.
No,
How long
no.
has it been taking
It
him?
has been there for years.
For years?
Yeah, but it's not affecting his daily activity. You know, this is a guy who is very active, and you know he loves go fishing and
I
all
see.
those things. And he said, just walk casually into my clinic and lift up his pants and just sit down there and show the tumor to me and just smile.
So maybe just roughly, what kind of diagnostic?
This
method
is a liposarcoma.
Yeah,
this is
the 脂肪肿的。
yes, yes.
So what was the treatment on him? Just removing.
It's a massive dissection, a massive resection of the tumor, release it from all the muscles, all the way to the bone, and also all the blood vessels, especially the femoral artery, you know, and also the popliteal artery at the back of the knee. So it was a huge surgery, but he recovered very well.
All right.
Yeah. It's very good and it's very active.
All right, good. So it is a benign.
No, this is a low grade malignancy.
Oh, it's a low grade malignancy. But
Yes.
it's still okay. But wow, I think he's one of the lucky guy because
he's really lucky.
I see. Understand.
Yeah.
Understand. All right. So we have another patient that we would like to show. This actually is a very powerful and very convincing testimonial from one of another patient called Premnath Analaki Chandran. Let's see what is his story.
When it was a small, tiny of a pimple size on my knee, started to grow, like a few months, like 3 to 4 months already started to grow. Then Dr. Chai Peng also, she was says, suspect something is going there, and she did a biopsy. Then biopsy from there, she find out it's a sarcoma. So Dr. Chai planned for me for operation to remove my knee. So she said I have to do some plastic surgeon, flat. So overall, the treatment I say that give me a best treatment. They managed to save my leg and I'm able to walk today.
All right. So that is one of our patients. So what kind of soft tissue tumor did he have?
Prem has synovial sarcoma.
It is malignant.
It is a very
Malignant.
highly malignant,
Highly malignant.
soft tissue
All
tumor.
right. What stage was he when he see you?
It was stage 3
Stage 3.
because the tumor was very big.
Oh.
Yes.
But it started as a pimple size though.
Yeah, over a couple of months, the tumor grew to. You see, when you feel a pimple size, that was the tip of the iceberg that you are feeling. Deep inside, there was a huge mass of tumor tissue deep inside. But when you felt the superficial part, which was the tip of the iceberg, so that was like small, but inside was quite big. Okay, but that whole thing grew over the next couple of months to become really big, deep tumor involving the muscles in the knee and also the knee joint.
Oh, okay. So when was he first discovered this pimple size of?
It was somewhere in the late 2017.
2017.
Yeah.
Now it's 2000.
Surgery was done in 2018.
Okay, following year.
2018.
Okay.
I think in the middle of June or something. Yeah.
All right. So now this year is 2025. It has
Yes.
been 7 or 8
7
years.
years.
7 years.
7
so
years.
is he considered fully recovered and cancer free?
The story is not so straightforward.
Okay. Well, soft tissue tumor never has straightforward story.
First of all, the initial resection was a very massive resection, which required a free flap reconstruction to close the defect after the tumor was excised. Okay, so that itself is already a very complicated surgery, and it took him quite a while to recover from that surgery because there are some other smaller hiccups. You know, the wound developed some problem. But to cut the story short, he he was accidentally noted to have a small nodule in the lung.
Also, it spread to the lung.
Yeah,
Because it's a
during
stage
something like a routine
Checkup.
surveillance
All right.
examination, and found to have a small lung nodule, which later proved to be a metastatic synovial sarcoma. So in total, this is a stage 4 disease.
Understand.
But the lucky thing for him is we detected the metastasis very early when that metastatic nodule was still very small. We had it excised by a very good cardiothoracic surgeon, and he made full recovery from then on, and the tumor never recurred, never metastasized after that. So this is 7 years down the road. So, I mean, clinically, he is cured of the tumor.
I understand.
So a stage 4 highly malignant tumor, gone through a massive resection, reconstruction, developed a small metastasis, which was also adequately excised, and then he is well after that.
I understand. So by listening to Dr. Chai's explanation about Prem's journey, in his recovering journey, so it sounds like there is a team, a multidisciplinary team,
Yes.
played a very vital role in his treatment and recovery. Just to summarize for us,
It
because
is,
I think
it is never a one-person
Person.
job.
Right.
Okay, there are times that we need our colleagues to come in to help us to solve other problems. Okay, one of the specialty that I work very closely with is the plastic surgery. Okay,
Exactly.
yeah, because if you cannot close the wound after the excision of the tumor, you have a big problem.
oh,
The
Never
wound
thought of
needs
that.
to be closed. The structures need to be reconstructed. There are so many surgeons out there who has no experience in plastic surgery or have no colleagues in the plastic surgery that can help them. They can never adequately excise some tumors. And a false excision with a false primary closure will most likely result in a recurrence. So to do the job properly, sometimes the skin, the subcutaneous tissue, the deep fascia, the muscles, the tumor need to be excised in total. And after that, you have a big defect in the limb or in the part of the body that you need to close and reconstruct. And that's when a plastic surgeon becomes very important. So we work very closely hand in hand with them. And that is the importance of a multidisciplinary team. And sometimes the cardiothoracic surgeons are also very important, where they come in and help us do the, whatever recurrence or metastasis that the patient may have to.
I understand. So it's luckily he came to Sunway Medical Center because we offer a comprehensive wide range of services, from the cutting-edge diagnostic methods to innovative treatments to even post-surgery care. So in his case, right, just summary, from the beginning he have radio, have done some imaging, and have done some biopsies, and then after that have done some surgery, including
everything in this hospital.
Everything in hospital, so he's lucky. Now he's clinically is considered cancer-free. So there's a question from our, there's a few questions. So guys, yes, please take this opportunity to ask question to Dr. Chai Ping Ching. So we have question from our audience. Can soft tissue tumors spread to other parts of the body? Kind of answer that question already.
Yes. The different soft tissue tumors have different tendency of metastasis. Okay, but in general, the favorite place that they metastasize to is the lung. Okay, and sometimes to other bones, sometimes to the lymph nodes, sometimes to other soft tissue. For example, a type of liposarcoma called myxoid liposarcoma has a very unique way of metastasize, is that it will spread to other soft tissues. And sometimes it will spread to the spine. But this is very unique of myxoid liposarcoma, but not the others. There are also other sarcomas, for example, like epithelioid sarcomas. They match to the lymph nodes and things like that. So different tumors, they have different behavior. But in general, the lungs is the favorite place.
I understand.
Yes.
There's another question from, once treated, can soft tissue tumors come back?
Yes.
Relapse?
Yes. Yes, even benign soft tissue tumors. Not all benign soft tissue tumors are actually very benign in the behavior. Some are very aggressive locally. For example, fibromatosis, I mentioned that. Okay. There is another soft tissue tumor called PVNS. Okay.
What is that?
PVNS is pigmented velonodular synovitis, which commonly occurs in the knee, inside the knee joint from the synovial lining, which is extremely difficult and challenging to excise completely and has almost a 100% recurrence rate if the excision is incomplete. So this is a benign tumor, but the behavior is like a malignant, but it's recurrence. And then sometimes a local infiltration, for example, fibromatosis is notorious for infiltration, local infiltration. And it can be even fatal sometimes when it infiltrates and involve very important structures, for example, blood vessels, nerves, things like that.
So even the name itself earlier that Dr. Chan mentioned is so long. I can't even hear what's the full name. What is the full name of the tumor?
The name of the tumor, in short, we call it PVNS. It is not very uncommon. It is rare to a certain extent, but it's not very rare. It usually affects young people, and usually the joints that are affected are the knee joints. They present with swelling, increasing swelling, and things like that. Yeah.
Okay. So back to the patient Prem earlier. It is so happy, so glad to hear that actually he's clinically cancer-free. And then, as a matter of fact, I heard he actually went for his master after the treatment, and also he also went for attended yoga classes. Now he's a yoga teacher.
Yes.
So okay, so like guys,
Prem is an amazing young man,
right?
And who never give up, and who always persevere and always very cooperative with the doctors.
Right.
Yeah.
Yes.
So
there's earlier I had mentioned that patient himself or herself play a vital role as well.
Correct.
And please don't wait and see, even though it's painless. You must have a strong will and must have a strong determination to get it cured. It is beyond the medical procedures.
Yes, the trust of a patient in the doctor is very, very important. Because when you seek treatment with us, especially for malignant tumors, basically you're putting your life in our hand, and our job is to make you well again and give your health back to you. So a patient must trust the doctor and must cooperate with the doctor.
I understand.
In the treatment process.
All right.
And if you keep running away, it is very hard for us to help you. Yeah.
Understand. So it's a mutual trust between the two. So let's carry this positive vibe into the next segment, which is an exciting segment, our quiz time. So guys, all you need to do is just answer a very simple question, and you will have a chance to walk away with 150 ringgit touch and go e-wallet credit. All right. This is how this quiz is gonna work. I will ask three very simple, super simple multiple choice questions. It's either A or B. All you need to do is just type your answer in the comment A or B. And then after that, at the same time, before you're typing your answer, please make sure you indicate what question is that, or prefix your answer with the question number. For example, if question 1, you can type Q1, A or B, all right? And then at the same time, Dr. Chai will give a lucky number. Okay, if our backend team will count through the answer. If your answer matches with the lucky number of Dr. Chai, then congratulations, you're gonna be the winner. At the same time, while we are doing this quiz, we are still receiving questions, so we will try to answer as many questions as we can. All right, without further ado, this is the first question. All right, the first question is, soft tissue tumors are always harmless and not life-threatening. True or false? Okay, Dr. Chai, please give a lucky number.
15.
15. All right. The 15th correct answer will be the winner. While we are waiting for our viewers to answer, to play this quiz, so we will back to the question. There's a question from our audience. What is the cause of tumor? I think this is very difficult to answer. Yeah. Lifestyle, eating habit, or maybe genetic?
I would say that how a tumor happens is usually multifactorial. There are many reasons or etiological factors in play together. A person may have some genetic mutation. There are quite a number of malignant or even some benign tumors that have some genetic mutations. Mutations means there is a change of the original DNA.
Oh,
okay, part of the DNA, the part of the chromosome. Some DNA may have switched with another chromosomes. You know, sometimes it's a translocation. So it is, but what makes this thing happen? What triggers the mutation is the $1 million question. Okay, and usually it is a mix of a lot of things: your lifestyle, your environment, what you do to yourself, what you consume, what you apply on yourself, what you are exposed to sometimes from the living environment, from the working environment. It matters. I think it's a mix of everything.
I understand. I hope that answers your question. So, back to our quiz. The winner for the quiz number 1 is Mr. Liu Yok Long. Congratulations. And guys, please stay with us until the end of the show because we have 2 more questions to ask. The second question. Benign soft tissue tumors are always harmless and not life-threatening. True or false? Please make sure you prefix your answer with question number Q2 and then write Q2, either A or B. It's a very easy question as well because throughout the show we actually have been repeatedly telling this. All right. So what is the answer is quite easy. As long as you have been paying attention with us, you will get this fine. Okay. So I think
you want me to pick a number?
Yes, I want you to pick a number.
Number 12, please.
Number 12. Okay, the 12th correct answer will be our winner. Okay, so I do have another question to ask Dr. Chai.
Yes.
What is your advice? Because I think it's really a human behavior that we always would love to wait and see. You know, especially soft tissue tumors is very hard to identify whether it's a tumor or not because it's painless, and it can be as small as a pimple. So what is your advice to them?
Number 1 is you need to have quite a high index of suspicion. Okay, both from the patient and also the doctor that first examined the patient. You know, we people like us, we the tumor surgeons, we are usually the last doctor that the patient will come to. Usually they will go and visit some other doctors before they come to us. And in Malaysia, the commonest doctors that they see is their general practitioners or family doctors.
Right.
Okay. And I have so many patients that came to me and said, "No, doctor, I actually been to see so many doctors, you know, and every doctor said, never mind lah, can wait and see lah. Is most
no pain, ma.
is most likely a lipoma lah. Can leave it alone lah. You know, and sometimes we say, why you come so late? And the patient said, no, I actually been to see many doctors, and those doctors always tell me, no, it's okay. So therefore, you know, I keep it until today. That's the reply of so many of my patients. So the thing is that what the mind doesn't know, the eye will not see. So you do not recognize that this could be something sinister.
Right.
Okay, and you wrongly advise the patient. So the doctors must have a high index of suspicion and be able to recognize that this is something very abnormal. This should not be there. It should be properly investigated and examined by the people who know how to do it and know to whom they should refer the patient to. It is very important. So the first thing is a very high index of suspicion. Number two is the patient's attitude towards this problem that they have. Is that most people will have a fear when they first detected something. Is that, what is this? You know, I suddenly feel there is a swelling in my knee. You know, what is this? And then sometimes the patient will say, okay lah, wait and see lah. The commonest response and reaction from a patient is that I'll watch it for a while and see what happened. And sometimes they watch and watch and watch and watch. And sometimes when things even become worse, the fear got worse as well, and there comes denial. The fear plus denial can be fatal.
Yeah, because you're so worried.
And they're so scared to face the truth. When they come in to see the doctor, I have so many patients who walk into my clinic with that fear in the face. Is that they know they sit down and Dr. Chai is going to tell them, look, this is cancerous.
Right, and then
they cannot face it.
So
that is the problem. It is very normal human reaction.
Right.
So sometimes we have to tell ourselves, yes, I have a problem. I need to check it out. I better check it out when it is early and easy to manage than when it is late and become complicated, and sometimes a small problem become a big problem. Okay, so the patients sometimes they have to tell themselves that they cannot delay anymore.
Understand.
Yeah, and sometimes the family members play a vital role as well.
Right.
Yeah, some family. I have a elderly man came with me with increasing pain, swelling in the axilla, and this old man has been complaining to the children that he has a swelling in the armpit, and the children just brush him off and say, no lah, nothing lah, you know, it's okay lah, tak apa lah, and never brought the patient to see the doctor. And when they came in, this is a stage 4 disease.
Understand.
And what is the use of you crying after that when the patient first complained to you, you ignore him and you take no action.
Understand.
And when things become bad and you start to beg me to do the best I can for the patient, it's a stage 4 disease.
Right. Sometimes you only realize the issue at a much later stage.
Yeah,
so
sometimes a family member also play a very vital role. Sometimes the patient, they are helpless. You know, they need the support and the help from the family patient. So the family must also understand and take appropriate action for the patient. Sometimes it's a child. In the context of a pediatric patient, the parents are very important. There are parents who actually ignore the children's problem. I'm so busy, I got no time to bring my child to see doctor. Until today, when the tumor is so advanced, then only you bring. And you expect me to perform miracle.
I understand.
Okay.
So sometimes, as advice to all our viewers out there, right? So even though it is a swelling alarm, please make sure you see a doctor immediately. And even though it is benign soft tissue tumors, it's not necessarily always harmless and not necessarily not life-threatening. So the answer of the question 2 actually is false. All right. This remind me I didn't give the right answer for the first question. The right answer for question, soft tissue tumors can occur at any age, from infancy to old age. The answer is true. Yes, it can occur at any age. All right. So the answer for question 2 is false. It's B, and then the winner is Roslina Rosalie. Congratulations. Okay, that brings us to question number 3. Often malignant soft tissue tumors are painless. Often malignant soft tissue tumors are painless. True or false? Okay, while we're waiting for the, yes, pick a number, please. I always forget this part. Lucky number.
21.
21. All right. The 21st correct answer will be the winner for our third question. So while waiting for our winner, back end to count through the correct answer, there are a couple more questions here. The first question is soft tissue cancer usually inherited?
No.
No. Usually it's not.
No.
I understand.
There are tumors that have some kind of genetic kind of factor where it can be passed down from the parents to the children, but they are mostly how to say,
develop on its own.
Yeah, it develops on their own. Even with mutation, it will not pass down to their next generation.
I understand. So for those married couples, if you so happen you are the patient of soft tissue tumor, please don't worry that you may pass down the tumor to your children. And then the next question is, this is a patient actually. He asked or she asked, does a soft tissue tumor mean I will need to amputate the affected limb?
No.
Oh. Okay. Absolutely no.
If it is deemed unsalvageable, then yes, amputation sometimes is the only option. But since the past 10-15 years, amputation is becoming rarer and rarer, and this is because of early intervention made for the patient. So medicine has progressed tremendously in the past 10-20 years, where the imaging techniques become really very, very good and widely available, okay, and a diagnostic part as well, the pathologists, okay, and oncological services are also more widely available now with better drugs, okay. And for us surgeon, we started to establish orthopedic oncology as a subspecialty started about 20 years ago, and is beginning to grow quite well in the past 10 years. So there are more and more orthopedic oncology surgeons in the world nowadays, okay? So we can give a better service and better care for the patient. And patients themselves, because of the availability of information, accessibility of information, with the help of internet, okay, and social media sometimes, okay, so they started to learn about things like that. For example, what we are doing today, we're trying to reach out to as many people as possible. So people learn and people realize, they understand, okay, and they take action. And they go to the right doctor and they start to seek treatment early. Okay, so all these things combined makes the chances of limb salvage much higher nowadays.
I understand.
So we can do the right investigation, do the right surgery, do the right subsequent treatment, for example, radiotherapy and chemotherapy or whatever you need, and we can save the limb, and patient can maintain the skeletal integrity, can preserve the limb function, and continue with a near normal life, most of them.
So I think there's a few key takes away from what Dr. Chai has mentioned. First thing first, if you discover uncomfort or if discover a swelling, a lump, then you don't wait and see, you must see the doctor. And second thing, you must see the right doctor to begin with, because if you fail to see the right doctor in the first place, it will make the subsequent doctor much difficult to treat you.
Yes, the human body is not a machine or not a car.
Can restart.
So if you wrongly replace a spare part, you can dismantle the engine again and then see which is the correct spare part to replace. Then you can reassemble everything together and the car can still run as good as before. But the human body is, flesh and blood. And first surgery is the most important surgery and is the surgery with the highest chance of success. Okay, and subsequent surgeries become more complicated with a poorer outcome. So as you drag on and on, things become worse and worse, and so is the prognosis for the patient. The chances of survival, the chances of recovering the function become worse. So the first attempt of treatment is the most important.
Right. And also, thirdly, I think another very important element is that you must seek medical attention to the right medical center, because it takes a multidisciplinary team effort to make it a successful treatment, right?
Yes.
So it's not just a surgeon, it includes the right pathologist, the right imaging team.
Yes.
So it all takes into account for a successful treatment. So I think that is a few key takes away from our today's.
Rehabilitation is also very important.
Yes, because it takes time
to recover. Yeah, and go back to the function. It is very, very important.
So with that, it brings us to the winner of our third question. The winner, before that, let's tell you the right answer. I'm sure all of you know already. The right answer for that question number 3 is true. And the winner is Xiaoping. Congratulations, Xiaoping. Congratulations to all the winners for all 3 questions. Please direct message or DM or inbox our admin so we can take your contact details in order for us to send you the QR code of the Touch and Go 150 Ringgit e-wallet credit. So please make sure to all the winners, all 3 winners, please make sure you DM our admin. All right. Our discussion today almost come to an end. Before we're letting Dr. Chai go, Dr. Chai, do you have anything else to advise our viewers, our audience?
I think with the availability of various informations nowadays.
Right information,
yeah.
Not those WhatsApp. So you send no.
Okay. It is very important that we continue to learn how to be responsible for our own health and well-being. Okay, and we must learn the right thing from the right sources.
Okay. Yes, that's very important because you know, as you mentioned, a lot of patients got tumor, they go and see masseuse.
And not in Malaysian words, a lot of ajaran sesat. Okay, there are a lot of things that people spread from mouth to mouth, and sometimes it's not true and it's baseless. Okay, so we must learn to differentiate what is right and what is wrong. Learn the right thing. Be responsible for our own health and well-being. Number 2 is, if you notice that there is something wrong with your body, anything at all, please take action early. Okay, do not ignore all the signs and symptoms that the body is trying to send to you and say, hey, hello, there's something wrong with you. Please take notice and do something about it. There are things that are not supposed to be there, so don't keep that thing that are not supposed to be there. Check it out, and whatever needs to be done, let's do it early. Take early action to have the best possible outcome. Because after all, this is what we want. A continuation of the good health, and not trouble after trouble. So if you delay seeking treatment, the process can be very difficult and the outcome may not be as good as
you want.
Yeah. So after all, our own health is in our own hand. So you take a good action will lead to a good outcome.
All right. As we draw to a close, thank you so much, Dr. Chai, for being with us today. It's
Yeah.
truly our privilege to have you on the show, and we have learned so much about soft tissue tumors. And guys, please give some loves emojis and thank you to Dr. Chai in the comments area. And your expertise really shed lights on such a complex topic. Even the name itself is so complex. When I read through it, it's so difficult to pronounce it, to be honest with you.
It is my sincere hope that whatever we do is the beginning.
Right.
It's a beginning to create more awareness
Yes.
among the public.
Right.
After all, specific information like this is not readily available.
Correct.
Yeah, so we try to reach out as many people as possible to create the awareness, and hopefully this can help
Right.
as many people as possible.
Right. I think Dr. Chai mentioned we really want to create awareness to the world, to not only to Malaysia, really to the world. So one thing you can help us to create awareness is this live will be available on a page for replay or reshare. So if you don't mind, after this show, you can share our live video on your social media. And thank you so much for tuning in.
I think I have something to add too.
Yeah, sure, please.
Okay, there's a lot of wrong perception among the people, in general people, is that I'm going to die, I have cancer. No. Cancer is not the end. And early cancer in the hands of
Right team,
right-
right person,
right
doctor.
doctor in the right setting, it is completely curable.
Yes.
It's completely curable. A very good example is Prem's example.
Right.
He has stage 4 cancer and he is cured.
Yes. and
So even a metastatic cancer, if you detect the metastasis early, do the right thing for that metastasis, there is still a chance that you can have a long-term survival. Okay? So cancer is not the end of the world
Yes, correct.
if you do the right thing.
Right.
If you do the wrong thing, sometimes early cancer can become an advanced cancer, or even a benign tumor can kill you.
Yes, I totally agree, because
Yes.
I'm a live example, because I have a family member who has a breast cancer. She was denying the lump on the breast, and
Yeah.
then it waited until stage 4.
Yes.
So it's very important.
It is very common in our healthcare setting that the patient present early to the doctor, but because of delay in many steps in the process of investigation and also treatment, potentially curable disease becomes uncurable.
All right. Thank you so much, Dr.
So
Chai.
that is very sad.
Yes.
Yeah,
there-
we
and
hope
there's-
this can be prevented.
Yes, it definitely can be prevented, and it's on your hands. So thank you so much for everyone to tuning in, and your engagement has been phenomenal. So till we see so take care and be safe till we see you on the next one.